For many people, cancer treatment can change their appearance, how they feel about themselves, and their desire for intimacy. Lucy Barnes and Dr. Richard Sullivan share some of their ideas on how to help you and your partner talk about sex and intimacy during your cancer treatment.
I often start by talking about the fact that it's really common to lose your desire for intimacy while you're having cancer treatment. So chemotherapy, for example, you can have a change in body function. There's of course the change in appearance, hair loss, and an increase in fatigue and nausea, which makes a lot of women feel like they don't want to be intimate during treatment. I would normally start again by talking to the woman about what to expect in terms of bodily changes, and that it's very normal to have a change in a need for desire or intimacy during treatment. I would often advise taking time with that, so not pressuring themselves to start having more intimacy in the relationship, but taking time and talking with your partner about that.
The whole relationship during cancer and the fears of chemotherapy, what does that mean, what does a sexual relation look like, is really complicated in cancer. Different areas have different challenges. So for a woman who's got breast cancer and is going through major physical body changes, there's a lot of psychology that's important in that space, and part of it's about that just ongoing comfort of who she is and what that means to her. And I think it's critical that you talk about the sexual relationships and having sex in that space, because it is about who we are and about how we feel about ourselves. That is a different conversation for somebody who's obviously unwell and got a whole lot of symptoms, but inevitably when sex is important in a relationship, it's really important that people know that's okay, and it's life is for living, and it's about enjoying what's important to you.
The other thing that can happen is women say that they do lose their sense of control over their body, even though they haven't. That's a feeling that they get, and that they've lost some of the privacy around their body. So that all adds to not really wanting to become intimate. I again encourage people to be really open and honest in relationships and keep talking about those issues. So it can be a problem for partners as well, where they don't know how to ask for intimacy and can feel like they're pressuring or hurting their partner. So again, talking about that can be a way to navigate through it.
I think as a profession we don't talk about sex during cancer enough, and treatment and what that means for people, and so I think it's a good challenge to all of us really to be more open about that. The other side of that conversation is also fertility. Many people we look after may still be of childbearing age, and so it's important to also raise that issue, because these are the things that are real to people. In the oncology sphere, we'll spend a lot of time talking about drugs, treatments, statistics, outcomes. Actually, what most people want to know is, what does this mean for me, and what does life look like at home, and how am I going to live, and can I cook dinner, and can I drive a car, and can I have sex with my partner? And so it's embracing that whole world.